Hi, everyone, and welcome to the Best of Life Summit. Ageless, authentic, and indefinable. Women's Health Conversation was founded almost 10 years ago, knowing that women make 80% of all the healthcare decisions in this country, not only for ourselves, but for everyone we touch, whether it's in our home, in our work, or in our town. Knowing that we can empower women, educate them, and help them understand the true power they have to change not only the health of the people they love, but ultimately our country, our culture, and our economy is the driving force for women's health conversations. We've had a terrible year. I mean, even if amazing things came out of it, we have lived in a way that we never had before. But for me, as like for many of you, we've learned so much about ourselves. And so, as we were thinking about how women's health conversations could give back to you and relaunch in a powerful way, we decided to focus on living the best of life, living ageless, authentic, and indefinable. For those of you that don't know me, I'm Dr. Vonda Wright. I'm an orthopedic surgeon, and I'm the founder of Women's Health Conversations, which has grown over the last 10 years into an amazing community on Instagram, Facebook, our Facebook group, as well as our web page, which has hundreds of blogs about living the best of life at every age. So we're happy to be with you today. This is actually the second session of the Best of Life Summit. Our first session was amazing. We had 5 guests talking about the best of relationships, the best of sex, the best of technology that brings relationships intimate and interpersonal to the optimal state. So if you've missed that, go back and listen to it. We had Dr. Kelly Casperson, Dr. Juliana Hauser. We had Jerry Ann DiPiano, who's the CEO of a company called FemPharma. We had the incomparable Natalie Benzavenga. So if you need to go back, you go do that. But today in this session, the Best of Life Summit, we are going to be talking about the whole woman. How do we get the best of health? Not as a body part, not as, oh, my knee hurts, oh, I have a headache, but how do we get the best of life through the best of health and have our clinicians treat us from the top of our heads to the bottom of our feet? So we're going to be talking about that today in this session. Listen, I don't want to be 20 again. I don't know about you. I don't think any of my girlfriends want to either. But what we want to do is live the best of life at every age. So before we go to our first speaker in this session, I want to tell you about a really exciting addition to Women's Health Conversations that we've invented. It's called Ageless. And look at the spelling of that. That is the phonetic spelling of ageless, because as we discussed what it means to be ageless, to be 40, 50, 60 and beyond, we discovered that at this age, sometimes we become invisible to the public. We're here to ourselves, but we're invisible to the public. Sometimes the public tells us how we're supposed to be. Or maybe there's a conformity to, I don't know what a woman in the middle is supposed to act like. I just know what I feel like, right? So we have decided to make a community of ageless, authentic, and indefinable women as a private membership, a community where you can be in pursuit of the best of life and know the truth of how to get there. There is so much confusing information out in the media today, but we are curating it. We're bringing us together in a way that we can actually have conversations like this. So if you'd like to know more about it, check it out. The website is up this morning. It's just become available. And the reason we spelled ageless phonetically is because we are indefinable. And we want you to be indefinable too. So check it out, ageless.life. And right now, we're going to turn to the best of life session for this morning, the whole woman. You know, our first speaker is a good friend of mine. She sits on the Share Care board with me, but she is America's family doctor. Let's listen to what she has to say about getting the healthcare you need and framing yourself as the whole woman. This morning, we are so excited to start off our first segment of the Best of Life with Dr. Jen Caudle. You know, I've known Jen for a long time, and you probably know her from all the amazing coverage she's been doing of COVID for the entire year. She is America's family doc, and I hope that you will seek her out everywhere because the information she brings is so critical. Now, as a family doc, you know that she is responsible from your life from the minute of your birth to the minute of your death and treats well patients as well as those dealing with chronic illness. So, as Dr. Caudle, I'm so excited to have you here today to frame for us the way that we should think about our health and how we should think of ourselves as not just a diagnosis. My pinky hurts, my knee hurts, my headache hurts, but as a whole person. Does that
Yeah.
resonate with you as a family doctor?
I can't tell you how much it does resonate with me. And I know, Vonda, you and I have talked offline about the importance of really thinking of ourselves as the whole person and as physicians treating our patients as a whole person. You know, as a family doc, you're right. I do see people from birth to death, as they say, and I treat chronic conditions, but I also see well patients. But, you know, I think a lot of times people in general, but also particularly women, right? Women do everything. Women are rock stars, right? Women are heads of households. Women are breadwinners. Women take care of their families. They birth children. I mean, they're cooking dinner. They're doing everything. And women are also oftentimes the people that are in charge of healthcare for the family, making healthcare decisions, etc. However, what I would love to see women, our amazing, you know, our amazing family of women do, is to really, I guess, connect the dots, which is what we as physicians need to be doing too. Let me give you an example. Um, Patient coming in with a headache, you know, certainly it could just be a headache, or, you know, usually people are saying that their headaches have been more frequent or severe or something. That's why they're coming in. It's not usually a one-off unless it's something really bad. But usually they're saying, gosh, these headaches just won't go away. I just can't get rid of them. You know, what should I do? I've tried this, I've tried that. You know, and in addition to asking, and Von, as I know, you know, the questions that we ask as doctors, well, how long and when did it start and what are you doing? There's also this bigger question of, well, what has changed? Has anything changed? How is your sleep? How's your stress? Is anything different going on in your life? Oh, well, you know what? It's been really rough lately. I'm taking care of my parents now. Or, oh, you know, I haven't been sleeping for the last 2 weeks because of blah, 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 blah. Now, it's not always that simple or that linear, but I mean, and Vonda, I'd love to hear your experiences, but I'd say 8 times out of 10, it's not just a headache or even back pain or things like that. There's often a broader context that we as women need to make sure that we are not only bringing to the table to our doctors, but also giving ourselves credit for and not diminishing the importance of our whole lives and how it can impact our individual health.
I love what you just said about asking what is different because I think that people know themselves. They're not just going to show up for a typical headache
Right,
or, you know, something that they usually do.
right.
They know when it feels different. And so that's why I
Mhm.
wanted you to frame our expectations of how we should be approached. And if somebody doesn't ask those things that you've just laid out, it's critical. Another thing that I find, and um, this is more in the medicine world than the orthopedic world, but I would love your thoughts on the fact is men are from Mars and women are from Venus, even outside that crazy book. So just because you're not presenting, you know, heart disease is an amazing example of how women and men present differently.
Yes. Yeah.
So, what do women need to know, or how do they need to push if they
Yeah.
know, like you said,
Mhm.
something is different?
Well, it goes back to actually what you just said. There's a lot of fangirling happening right now, but it's true. You just said people know themselves. And I believe that too. I firmly believe that. I often teach my medical students, you know, if you just listen to patients closely enough, they will tell you what's wrong. Meaning, as women, we must trust ourselves.
Mhm.
Trust yourself to know that something is different. You may not know what the problem is or why, but trust yourself to know, gosh, I don't know, this doesn't seem right. And that trust in yourself is what I want women to bring to the table, not bring to the table, maybe bring to the exam table more often, even if your doctor is not listening the way we should be. And by the way, that happens a lot. Vonda, you know just as well as I do, we doctors, there's all these statistics out. We don't listen to patients longer than 4 seconds before interrupting them. That's an old one. We come to the office with our own biases, our own, medicine is not a perfect science at all. And that's one of the reasons why it is so wonderful that women in particular, we know ourselves, we know our bodies, and advocate for yourself. It doesn't mean that it has to be confrontational, but it does mean you deserve a proper seat and a place. And if your questions and concerns are not being answered or at least addressed, you have the right to seek out someone else or go somewhere else where you can get that. I hope this is validating, because honestly, patients, as a doctor, I can honestly say my patient is my best assistance when it comes to me trying to figure out what's wrong with him. I need you. So I really want women to stand in that power and stand in that place of saying, you know what, look, I don't know. It may not be anything, but I know I feel different. And so you deserve to have that addressed.
You know what? I hope that everybody is listening feels so heard and validated by what you just said, because I think there is a mystique of medicine, even though, it's a different medicine now than it was when, the people who trained us were coming up.
Right.
But there is still a mystique where people don't feel like they can ask the next question, where they can say, yes, but I know myself. And you just gave permission to people, which I give permission all the time. Find the physician that will listen to you, right?
Yes.
Is there a way, as a patient is preparing for you to listen to them, that you would like them to think? How can they prepare for their visit with you so that it is a partnership and you can treat the whole woman?
I love that question, because it really is a collaboration, right? Our office visits, it really is a beautiful song and dance of collaboration between the patient and the physician. So I definitely think there are some things that patients can do to kind of get prepared for their office visit, because Vonda, as you know, we don't get a lot of time in the office. I don't know how much time do you get for like a follow-up office visit? Do you get 10 minutes, 15 minutes, more or less?
We schedule 15 minutes, but we double book.
That's what I know you guys are always running. That's what I was wondering about. So yeah, you get 7.5 minutes with on paper, right? I get 15 minutes for a follow-up visit. And so I think it's important for people to understand that, to know that the system is already stacked against us both, physicians and patients, right? This is not ideal for either one of us. So it's important for us as physicians to be prepared for our patients to come in. But patients, I really love it. Number one is sometimes it can be hard to retrieve symptoms and things that have happened in the moment when on the spot. It's kind of like, urinating on demand. Maybe that was too graphic, or like something, try to, sometimes it can be hard. If you're not prepared for it, you're like, oh, really? Now I got to go right now. So what I tell people to do is, if there are symptoms or things you have concerns about, jot notes down either in your phone, on a little scrap of paper, keep it in your purse. And timelines matter. They matter for me as a family doctor. I know they matter to you as an orthopod. When did it start? What happened first? Everything is a story. So jot things down. I would say the second thing, as a family doctor, since we deal with so many issues, most of my patients don't come in with just one issue. And I say that's okay, but sometimes we can't deal with all issues at one time. But I want to hear all the things you have concerns about, because if you have headache and maybe a back pain and asthma, and at the bottom is chest pain, I may need to rearrange that list about how we're going about things. So tell me all the things up front that you're having concerns with, so that we can plan our visit and decide, oh, okay, why don't we talk about the chest pain now? And then we'll and then the last thing I would say is that, and you can see I hate talking about this topic, right? I just hate it. But the last thing I'll say is just to make sure that you know your medications and your and their doses. Knowing that it's the little blue pill or the yellow green pill sometimes is not as helpful for me. So if you can make sure you keep a list, honestly, or take a picture of your pills, or a lot of my patients just literally bring them in a bag. They dump them all in a bag, and they love that bag in the office. That makes me a really happy camper as a doctor.
Oh, that is amazing advice. And I'll tell you what I take one step further for if there's people out there like me who I not only take care of myself, but you said it earlier, we take care of the health of the entire family. And in my family, my elderly parents live with me. So I'm
Yes.
a sandwich generation. And
Yeah.
you think it's hard to keep track of your health when you're in, my age bracket. It's really hard when you're 70, 80, and you've got multiple things. I do exactly what you just said, Dr. Caudle.
Oh,
I've written it down. I've written their whole history from
oh, good.
everything that they've ever had, their medicine, so that when we do go to the doctors, their family doctors, it's a more streamlined thing. So these are all tools so that we don't get caught up in the time restrictions that scheduling and insurance companies put on top of us, but that
Right.
so doctors like you and like me as a musculoskeletal, believe it or not, I do treat the whole woman, but
Yeah.
especially with primary care doctors like you, can really organize around an entire life.
Right.
Yeah.
Right. And that's what we got to do. So no, I love that. And I'm so glad that you do that. I know you you live with your parents, and you're an inspiration as well, because you're such an example of what women are, and who women are, and what women do for their families, for themselves, for their children, et cetera. So it's wonderful.
Well, I'm thrilled that you took the time to actually headline this section on treating the whole woman. Jen Caudle is America's family doctor, and you will see her everywhere on social media and TV, and we'll publish her access. But thank you so much for your time today. I
Oh,
really appreciate it.
oh, thank you, Vonda. It was good chatting with you.
Farewell. Wasn't that great? That's Dr. Jen Caudle, America's family doctor. And I hope our discussion helped you understand that when you go to the doctor, that you may be presenting with one symptom, but you are really connected. You may have read somewhere that even our stomach is connected to our brain. Our heart is connected to our brain through the vagus nerve. Um, our microbiome in our gut is, that gut feeling you get that I made a decision with my gut, that's real, people. So when you go in to receive healthcare or think about how you're feeling, I hope this reframes for you that you are just not a sum total of individual pains or aches, that you are a whole woman and deserve to be addressed in that way. And so I thought in this segment, it would be amazing to bring on another one of my friends. Now, you probably see a pattern here. I have some of the most amazing friends in the universe, all very interesting women, smart, savvy women who have a variety of life experiences. That's what Women's Health Conversations is all about. Susan Koeppen was one of my neighbors in Pittsburgh. She is a Emmy Award-winning journalist. She's a TV broadcaster. She is a wife and a mother. She is a storyteller, and she has a remarkable story of survival when it comes to her own health. So I thought this morning, as we were discussing being treated as the whole woman, we would hear her story and get her perspective as all the things she does, from the journalistic perspective, from wife and mother perspective, from storyteller and health survival. Get her story about how to be resilient in this space, how to thrive as a whole woman. You're going to love hearing this, and we're going to love hearing her perspective. So I'd love for Susan Koeppen to join me now. Hi, how are you?
I'm great. Thanks so much for having me. This is a pleasure, and as you know, I love sharing my story because I really think it's a story that women need to hear.
As I was introducing this segment as, can we please be addressed as a whole woman, not just, I mean, you have a remarkable story you're about to tell us, but you're not just a heart. right? So did that resonate with you, um, as a woman, as a wife, as a mother, as everything you do? Or am I making that up?
No, you're never making anything up. No, no.
True. Yeah.
Yeah, and I think it's really important for women to know everything there is to know about their health and their bodies. And I mean, you know this as a doctor that most studies that were done in the medical world were done on men and then just applied to women. And it wasn't until I think maybe the 90s that they decided, oh, okay, I think we should start actually studying women's health on women to see that they are totally different than men.
You know, there's a very old movie, and I'm dating myself by even throwing it out there, but this name was described in the journal Nature. What you have just described, where women present differently and yet may or may not get the attention they need because we are not just little men, we are completely biologically different. It's called Yentl syndrome. Yentl was that movie where this young girl wanted to participate. It just happened to be in a Jewish temple, but only men were allowed. So she had to pretend to be a man to get to do what she wanted to do. And in health, sometimes that's what goes on. And so, in particularly in heart disease, which we're focusing, I've chosen that as the whole woman um, medical partner to discuss this morning, because heart disease in women is the number one killer. We think it's breast
Right.
cancer,
Right.
which is a big deal, right? I am not downgrading that, but heart disease, and it's what kills my family. And so that's,
Mhm.
I've got an added interest in that. Not only am I a mobility doc, but so interested that I even said yes to the amazing invitation to be the Atlanta president of the American Heart Association, because this is so important. And it's important that women be treated whole. And I know that's your
Yeah.
experience. So why don't you begin to share with our audience, whether they're live now or, this content's going to be available all summer as our summer reading, if you will, your story and how that relates to what we're talking about.
All right, sure. So I'm going to take you through my story. And my story began, if you want to say that, on in November of 2011. So I was 39 years old at the time, a wife, mother with three adorable little kids. And we are a very active family. And I wanted to run the Pittsburgh half marathon. And I've been an athlete my whole life, and I thought, this is one more challenge, one more thing that I'm going to do. I'm just going to run the Pittsburgh half marathon. So I was training for the marathon. And I want to show you a picture of me on um, November 19th, 2011. I like living life to the fullest. And so I was out shooting guns um, with a bunch of my friends, and we were having a great time. And I had everything going for me. Like I said, wife, mother, I had just started a brand new job anchoring the news in Pittsburgh and having a great time. We had a wonderful event shooting, and then we went out to dinner. The next day, I went out on a training run that morning, November 20th, 2011. And less than 24 hours after I was out shooting and having a great time with my friends, I was in the ICU at Shadyside Hospital, put on a ventilator. My family was told she may not make it. During that training run, I had suffered cardiac arrest and had just dropped on the sidewalk not far from my house. And my friends who were with me said that, when they got up to me, I was on the ground and had no pulse. I was turning blue. My friend Beth was feeling for a pulse and realized something was very wrong. And so she started waving down help and screaming for help. And at the moment that I collapsed, it was in a very busy part of town. Two medical students, Ron Mall and Vanessa, who were medical students at the University of Pittsburgh, happened to be driving by. They were going to go grocery shopping. They saw me on the ground and gave me immediate CPR. And a man walking by called 911, and firefighters were right around the corner. They arrived. They shocked my heart with an AED and continued CPR. Got my heart back into a rhythm, and I was out for 7 minutes. So for 7 minutes, I was clinically dead on the sidewalk in Pittsburgh, transported to the nearby Shadyside Hospital, where, as I mentioned, I was put in the ICU. I spent 2 weeks in the hospital, and eventually I had to have open heart surgery, which they did a couple months after my cardiac arrest. And people always say, all right, what caused your cardiac arrest? You were 39 years old. Well, there were multiple factors. One, I had mitral valve prolapse. And I knew about my mitral valve prolapse, and that's where the blood, the flaps don't close appropriately and the blood is flowing the wrong way. But I had gone for a stress test, and had been cleared by my doctors to train and run for the marathon. I was suffering from dehydration because I was coming off of a cold. There was exertion involved with the running. And also, I have a family history. My grandmother dropped dead on a sidewalk. Okay, so the story sounds familiar. Before my cardiac arrest, here were some of my symptoms. I had a persistent cough, especially with exercise. I was misdiagnosed with exercise-induced asthma. I was winded. I was tired. I was constantly clearing my throat. And I had frequent urination, which I was told, because I complained about that to a doctor as well. And I was told, well, it must be your large consumption of water because you work out so much, so you're always drinking water. But everything I just described to you, those are symptoms of heart failure. I did not know that before my cardiac arrest. I did not know that heart disease is the #1 killer of women before my cardiac arrest. I learned all of this after the fact. So I really think it's important for women to take control of your heart health and talk to your doctor and say, I want to know how my heart is doing. I know it's the #1 killer of women. So how is my heart? How am I doing? The American Heart Association says that 80% of cardiac and stroke events may be prevented with education and action. So that's why we're talking about all of this. I want you to spread the word to everyone who will listen. Heart disease, the #1 killer of women. That's why I do events like this one, Vonda, because I want everybody to know that fact, and I don't want it to be a mystery. Be your health advocate. And that's what I do now. I work as a woman's health advocate, and I try to spread the word as much as possible about heart disease. And I'm very happy to report that I did go on after all of my surgeries and after everything I went through. I continued to train, and I crossed the finish line of the Pittsburgh Half Marathon, and and had a wonderful event, and was thrilled that I was able to do that. And I live life to the fullest now. And I have a defibrillator implanted in my heart, and I have a fake ring in my heart that keeps that flap closed. But life is good, and I'm living my best life.
You know what, Susan, every time I hear you tell your story, and as you have expanded it, and with your work with the American Heart Association, brought in all these data, your heart event was a very meaningful event in my own life. And it sounds weird to say it, but it's when I started paying attention to heart disease. My family dies of this. Your husband is a surgeon. We operated on the same day. He and I talked about this while you were either still in the ICU, just out of it. I mean, this is a real knowing you really brought to the fore. Women are different from men. All your symptoms of heart failure, those could seem like nothing. And
Right.
yet all together, because you know yourself, you can put it all together now because you stand in a place of, I needed to be listened to. You know, we're not pointing fingers, but we're saying, listen, everything together adds up to something. And so that's what Dr. Caudle and I were talking about just prior, is that we cannot just be addressed as, oh, you're peeing too much. You drink a lot of water. It's everything together, right? So if one of our listeners feels like their story is not being heard, what do they do then? Because I'm a doctor and I'm going to tell you, I do the best I can to listen to the whole story. But what does a woman need to do as a self-advocate to be treated as a whole person?
Well, and here's the mistake that I made, and it was due to a lack of education. So when I complained to my doctors about all my different symptoms, so the excessive coughing, what
Yes.
is this? The being tired and winded, the frequent urination, I complained to different doctors about one specific problem. So I was talking to the allergy doctor, I was talking to my PCP, I was talking to my OBGYN, but only giving each of them one nugget that I thought was their specialty, right? So the OBGYN, I said, why am I peeing so much? Okay, the PCP, I cough a lot. Do I have a cold? Do I have bronchitis? What is this? So had I been educated about heart disease and knowing that it was the number one killer. And had I been educated about some of those symptoms that I talked about, I would have said, aha, wait, okay, I need to talk to a cardiologist. Okay, here's my symptoms. But I
Right.
didn't know that. So I think it's just crucial that we as women educate ourselves
Right.
about certain issues and realize, maybe it's like you're taking lots of medications because you're getting different medications from all these different doctors, and this doctor doesn't know you're taking that medication.
Yeah.
That we focus all of our symptoms and say to one doctor, okay, here's what I got going on. Does this sound like anything familiar?
And I think another point is, don't take no for an answer. Sometimes we try to be polite. I don't want to bother the doctor. I hear that all the time.
Oh,
I didn't want to
yeah.
bother you, right?
Yes, because you're very busy people and we don't want to bother you. Yeah.
And I appreciate that. But I want women listening to feel empowered to keep calling until they get an answer, or until a doctor says, I don't know, let me find someone who does know. Because I have found in my own health and in the health of my, I'll throw in this story. I am firmly in the sandwich generation. My parents live with me. My mother is 2 generations older than you. But all those things that you described, she had last February. And I am a surgeon. And I did not until the last minute put it together and say, oh my God, I'm going to call my best friend, the cardiologist here, because this, so it can happen to anyone. But my mother was in heart failure, and, thank God she made it through. And that's the happy end of the story. But these things that we're talking about are true. You're a whole person. You're just not a sum of your cough, of your urination, of your feeling, in heart disease, women sometimes feel fuzzy. It's like, I just can't concentrate. And it's because your body is using the energy that it normally uses to think, to perfuse, right? The heart's job is to pump blood everywhere. Well, I know that you are building an amazing life resume. Our work resume is one thing, but getting the experiences and our life resume out of these health experiences, you lived a vibrant life before this, and this event does not define you. It just adds to your story. Are you more resilient? Are you stronger in a different way? What is your perspective? And now you've lived through COVID, and all the pivots.
Oh, yeah.
That for you. So how has resilience and pivoting to a place of living in that affected your life?
I like to say that resilience is my middle name because I have I have faced all of it. Okay. So, major medical crisis where if you look at statistics, I should be dead. Cardiac arrest is 90% fatal. Survived that. When I left the hospital, I was walking with a cane. The next day, my husband brought me to the gym and dropped me off so I could walk on the treadmill. I was going at 0.9 with the cane on the treadmill, but I don't let the grass grow under my feet during COVID. So we're in this global pandemic. I lost my job. Okay. So what does Susan do? I pivot. I find joy in living my life. I became a ski instructor. I had been an Emmy award-winning journalist. And I said, you know what? I love skiing. I've always wanted to be a ski instructor. Now I have the time, so I'm going to do it. So I think that you need to live your life, even if it's just little things that you want to do every single day. I try to live my life with purpose and do something that makes me happy. Because if mama ain't happy, nobody's happy, right?
That's so funny. And you know what? I have to congratulate you on your choice of getting to do another life resume, because of course I chose to become a sourdough expert.
Right.
Yeah. And so you're getting fit, and frankly, I got a little fat. So maybe, but you know what? I appreciate your advocacy. You have a powerful voice, not only in Pittsburgh, but around the country. And I know you've used that voice with our next guest. So we're going to get her perspective. But I'm thankful for what you're doing. I'm thankful that you're willing to share your story, because women need to realize that being a whole woman and pursuing health for all of us is not just an outlier. It's every woman has a voice and needs to use it. So Susan, thank you so much for taking the time on this morning with us. And I really appreciate you. And I can't wait to see you again when I'm back in Pittsburgh.
Can't wait to see you. Thank you so much for having me.
It's my pleasure. Thank you. So isn't that the most amazing story you've ever heard? I mean, it is literally so close to my experience, because where she collapsed is 3 blocks from my house where I used to live. And I literally was colleagues with her husband, and we would talk about this in the heat of it. And the fact that putting the puzzle pieces together of all those individual symptoms she had is not an uncommon story. So as you're thinking through your own health, I don't want you to stop. If you get anything out of this morning's session, I don't want you to stop with, oh, I've got 3 or 4 things going on, but it's probably nothing. It may be nothing, and it may be something. And you are a powerful force in your own health. This is what Women's Health Conversations is all about. You are the most powerful force in your own health. You don't need my permission, but I am giving you my permission to use your voice. Keep asking the questions until you get the answers. Be polite, but don't be so polite that you don't get the answers you need, because that physicians are here to listen. And if we don't, I hope you will keep asking us. So it is very, I did this very intentionally, very intentionally. I'm bringing our next guest up. Dr. Suzanne Steinbaum has been with Women's Health Conversations since its inception. In 2013, when we had our first big conference, Dr. Steinbaum was a founding speaker talking about women's heart health. And so we have her back today because she not only is an extraordinary cardiologist, she has her own private practice in New York, and now is bringing her work across the country in holistic clinics. But she truly shares my conviction that women should be treated as a whole person. And we're going to bring her on and to talk about living from the heart. Dr. Steinbaum. Hi, how are you?
Hi, how are you, Vonda? Great to be with you this morning.
I'm so glad you could join us. And I know you know Susan Koeppen's story very well. You've worked together in previous conferences. And I think it is so telling what she said about her individual symptoms and the fact that I experienced that with my own mother last February when she went into heart failure after a series of little symptoms that, frankly, even as her daughter doctor, kind of blew off until we finally put it all together and we're like, I've got to get her to this cardiologist. So I know that's not a new story to you. So I'd love for you to share your thoughts on living from the heart. And then you and I are going to come back together and talk a little bit in a conversation about the root source approach to a woman's health. So I can't wait to hear what you're going to share with us.
I'm going to take what Susan said and sort of spin it a little bit and take it to another place. She always blows me away. Her story is mind-boggling, but unfortunately, she's not alone. But what I want everyone to realize is who we are as women is so important in understanding the women and heart disease story. We think about wellness as being these 6 factors. Who are we physically, emotionally, behaviorally, socially, how we think intellectually and spiritually? But what we do to drive these things forward, these behavioral changes like exercise and diet, that's not what heart health is all about anymore. We understand that if we don't look at ourselves holistically, how we function and how we choose to live our lives, we're actually going to miss the boat. When I finished my training in 2002, it was really not thought of that heart disease was a woman's disease. And in fact, when I began, there was a woman who was wheeled into the emergency room, 53 years old, sweating, sick, obviously very sick, and put in the corner with the diagnosis of gastroenteritis. We proceeded to watch her as she had a heart attack in the emergency room. And I was told there was no such thing as women and heart disease. That changed everything for me. And we would like to believe that Susan's story doesn't happen anymore, but that's not the case. In 2004, probably the woman who changed everything, a cardiologist, Nanette Wenger, said the community has viewed women's health almost with a bikini approach, looking essentially at the breast and reproductive system and almost ignoring the rest of a woman as part of women's health. Well, it's time now that we look at women for exactly who we are, not just breast health and reproductive health, but really all of the components of us that makes us who we are. Because heart disease is the #1 killer of all women. And in fact, it kills more women than all cancers combined. When we look at the statistics, too many women still believe that heart disease is not her #1 health threat. She doesn't even think about it. 52% of hypertension deaths are in women. When we look at the risk factors of heart disease in women, oftentimes they are more deadly, more toxic for women compared to men. And when we look at the overall health of women, 66% of women are overweight or obese. Women of color are disproportionately impacted, with 56% of Black women having high blood pressure and 46% of Hispanic women having diabetes or being pre-diabetic. But when we talk about the research, less than 40% of cardiovascular research participants include women, and we are in trouble now because of that. What I'm going to tell you today, what I'm going to share with you about living from the heart, is that each of us need to understand who we are. We need to understand how to prevent heart disease, because statistics show, and this study showed, that the first sign of heart disease in 64% of the women in this one trial was sudden cardiac death. When women get heart disease, their outcomes are significantly worse. They're more likely to have a reinfarction, another myocardial infarction or heart attack after having their initial. They're more likely to be admitted to the hospital with heart failure. They're more likely to have worse outcomes when they get sick. And where does this lead us to? This idea of prevention, this idea of holistic health and holistic healing. And that's what we really need to focus on. When women have chest pain, they're 2 times more likely to die. When women have bypass, they're 2 times more likely to do worse. Heart failure, 2 times more likely to have another incident. And as I mentioned, having a heart attack, they are more likely to die than men within the first year. So what does it come down to? It comes down to this concept of coronary artery disease, the most common form of heart disease. It comes down to understanding our symptoms. But what I want to talk about is the endothelium, which is the lining of the artery. This lining of the artery is what protects our arteries from getting damaged. What protects our valves from getting worse. It protects us from head to toe anywhere in our body that arteries exist. And this is a 1-layer lining inside the lining of the artery. I often think about it as like the lining of a pocketbook. When it gets torn, inside this lining goes plaque and goes cholesterol and inflammatory cells, and plaque develops because of damage to the lining of this artery. Well, conceptually, if we prevent this lining from ever getting damaged, then we can actually prevent the onset of heart disease. Heart disease in women is more subtle. As Susan mentioned, it's these little things. It's maybe not this crushing chest pain. Could be chest pain, but it could be a little bit of shortness of breath, a little bit of palpitations, a little winded and coughing, nausea, vomiting, jaw pain, back pain. It is up to us to protect ourselves, because the subtleties of these symptoms make us believe that maybe we don't need help, maybe we don't need to get checked out. And when we actually go to checked out, oftentimes we are misdiagnosed, and I hate to say it, somewhat ignored. Well, when it comes down to the heart, there are these 9 modifiable risk factors. We've known about this. If we can deal with the cholesterol, the blood pressure, diabetes, smoking, abdominal obesity, sedentary lifestyle, our diets, alcohol intake, psychosocial risk factors, we've got it. 90% of the time we can prevent heart disease. Well, is this always the case? It depends how we look at it. We have to remember family history, because certainly that plays a role. And if we have family history, then we do have to address this sooner and earlier than we would if we didn't. But there are other risk factors. It's become more complicated. This wheel of risk factors adds things like anxiety and depression and stress. We all understand the impact of stress and hostility and social isolation and putting ourselves last, which I think all of us really understand. When we look at other risk factors, things like inflammatory diseases, gestational diabetes, hypertension in pregnancy, early menopause, depression, these risk factors are much greater in women. Obviously, they're women-driven, but they lead to heart disease, and they've never been thought of as being the most important risk factors. But there are things that we definitely need to understand. And like I said, arteries are head to toe. So if we can prevent the damage of the endothelium, we can actually prevent heart disease. The most interesting thing happened. Do you know what this is? Look familiar? It's COVID. During COVID, we initially thought that this was a disease of the lungs. It was a pneumonia. And as time went on, we started seeing people have heart attacks, strokes. We heard of this inflammatory cytokine storm. There was what we call hypercoagulability, leading to emboli. Again, these strokes and problems with clots to the leg or clots to the kidneys or the brain. That was endothelial disease. That was damage to the lining of the artery. So what I really say is that if we protect ourselves, if we live from the heart, if we learn how to really protect our endothelium and really protect our heart, we will truly protect ourselves from so many different diseases that we don't have control over. So let's get to that endothelium. What do we do? What we've understand about the endothelium and what we've understand about women is that men get disease in one location. It becomes super easy to diagnose. When you look at normal and abnormal, we see the abnormalities in a man's artery, and it could be easily stented. I'm sure you've heard of putting a stent in. It can go in a location because it's discreet. But women and their endotheliums, the disease is diffuse. It's throughout that artery. It covers the endothelium and causes that artery to perhaps spasm or not get enough oxygen because it can't dilate. And instead of having distinct disease and massive heart attacks, we have what is more often called microvascular dysfunction, or disease of those tiny small arteries where a stent can't go in, where we can feel chest pain, but there's no evidence of overt disease that anything could be done. We can medicate, but we can also change our lives. We can also impact this microvascular disease from how we choose to live. Now, I will tell you, as we grow older and we go through perimenopause and menopause, the likelihood of microvascular dysfunction, of endothelial dysfunction goes up. These risk factors of heart disease, the blood pressure, the cholesterol, our weight, it goes up naturally. And if we fight against it with how we choose to live our lives, then we have the chance of not only decreasing endothelial dysfunction, reducing microvascular disease, but also changing the outcome of what we might look like if we didn't do anything, which 1 out of 3 times, heart disease will kill you. So where does it begin? Let's go back to Hippocrates 2,400 years ago. If we could give every individual the right amount of nourishment and exercise, not too little, not too much, we would have found the safest way to health. Okay, so let's start there. The benefits of exercise are unbelievable. Exercise is by far the best medication. It decreases blood pressure, decreases the cholesterol, it improves the good cholesterol, brings your heart rate down, weight loss, decreases diabetes, but it makes us feel better. It releases these feel-good hormones, as serotonin, and it actually can give us this notion of wellness. I can't seem to lose weight. I tried everything short of diet and exercise. Well, hello, we're going to start with diet and exercise. Is sitting the new smoking? We have all been sitting. I mean, has this time not been about sitting, about meetings in front of our computers, Zoom calls? It's all been about sitting. And we know sitting is by far one of the worst things for us. And in fact, one study showed that for every hour spent in front of the TV, there's an 18% increased risk of cardiovascular disease. I think about the 10 hours of Zoom every single solitary day for the past year. And what is that doing to us? So movement, we know, is so important. And the more physically fit we are, the healthier we are. With fitness, we have longevity and a decrease in mortality. The American Heart Association recommends 150 minutes per week of moderate intensity activity. We also recommend some strength training, but getting your heart rate up to this moderate level is the sweet spot to help relax the arteries and to help protect that endothelium. And in fact, if we can increase what we call our VO2 max, or minute ventilation, we can decrease mortality, even by improving our exercise capacity slightly by as much as almost 5%. And of course, we have to talk about diet, because diet is really what nourishes us, what keeps us strong and healthy. And a Western diet increases the risk of heart disease by 30%. And this is really what all of us have grown up on. It's the hamburger with the Diet Coke. I will tell you, my son has not grown up on that, living in a cardiologist's home. His whole life has been very, very different, as we do live a Mediterranean diet here. And that Mediterranean diet is filled with multi-grains, with fruits, with vegetables, beans, legumes, nuts, olive oil, and a very, very small amount of saturated fats. We understand that this diet, and multiple studies have shown, have really been able to decrease the incidence of heart disease. And in fact, this early trials showed that it decreased heart disease by as much as 70%. A later recent study showed olive oil and nuts can reduce the incidence of heart disease by as much as 30%. This is swapping out that butter for olive oil. This is really incorporating vegetables, whole grains, good fats, omega-3 fatty acids, and getting rid of the saturated fats and processed foods. But we've also learned that diet is not necessarily a one size fits all. There isn't a way to say, go on a diet. We understand now that prevention is not about this public health policy for everyone, that we can actually look at our genes and determine how we need to eat that's good for us. And apolipoprotein E is one of those genes. It has a role in lipoprotein metabolism, and having a certain genetic combination can tell us whether or not we can process sugars, whether or not we can process fats. And understanding our ApoE is another way that we down the road in the future will understand how to eat. Sometimes late night food cravings simply mean you need to go to sleep earlier. Sometimes it's not just about the food. Sometimes it's about how we choose to live. And this was a perfect example of a patient who could not lose weight. And we were talking, and she said she did laundry every night at 10 o'clock at night, and she had snacks while she was doing laundry. We figured out those snacks were about 2,000 calories, and I was joking around, and I said, just go to sleep earlier, and she did. Came back in literally about a month later and had lost 10 pounds. It's not just the food, it is who we are. And we need to figure out who we are to figure out how to live the most heart healthy life. We cannot not talk about heart disease and not talk about stress, because stress has been the most pervasive thing that has gone on for all of us in the past year. And stress is certainly has a huge impact on our hearts. When we're stressed in our mind, we become worried, we have negative thoughts, we become indecisive and have impaired judgment. Emotionally, we become anxious and depressed and irritable and isolated. And we choose to do things that might not be so good for us, like overeating, smoking, drinking too much, not sleeping. And what happens physically? We get a headache. But women, we tend to live from the heart. We tend to feel things in the heart. And in the past year, I've seen more women come into my office with palpitations, chest pain, shortness of breath, because we're feeling things differently. Our inflammatory markers are leading us to have symptoms in the place where we feel things the most. And in my opinion, that's in our hearts. So is stress the new smoking? This stress hormone leads to these markers, these hormones that get released within our bodies, the catecholamines, the epinephrine and the norepinephrine, and the corticosteroids, which are really the inflammatory hormones. What happens in the short-term stress response is the epinephrine and the norepinephrine get released, the blood glucose levels rise, we actually can hold on to fat. This is part of the problem for some people. They might not lose weight. The arteries clamp down. We have high blood pressure. We get short of breath. We get palpitations. And on the other side, we get these steroid hormones that increase inflammatory markers. And guess what all of this does? It goes right to the lining of the artery, to that endothelium, causes damage. And this is starting the process that can lead to coronary artery disease. Well, we all understand this process that goes on. Remember in school, when you had finals, I went to school forever, and this was part of my life. You would have finals week. This was the stressor. The beginning of the week, staying up all week, studying every night. This was this resistant phase. I'm going to get through it. I'm going to get to the end of the week, finals are over, exhausted, and I got a cold. And that whole process is what's going on with us all the time. Our immune systems drop. Our stress hormones are just pushing on our hearts. And okay, we understand the common cold on the outside, but just think about what's going on to your heart on the inside. We cannot not talk about this mind-body connection, especially when it comes to women and heart disease. Many women talk to me about not being able to sleep. Well, without sleeping, there's an increase in stress, and the need for sleep is about 7.5 hours per night. When women feel stressed, they're more likely than men to feel depressed or sad. They're more likely to feel nervous or anxious. They're more likely to have constant worry. They're more likely to feel overwhelmed, fatigued, lay awake at night, This is what's causing not sleeping, and more likely to become depressed. And when we look at depression in women, it's twofold more prevalent, and it can increase the risk of heart disease by as much as 50%. When we talk about all these silent and difficult and challenging symptoms that women can have with heart disease, I'm going to put depression in there, because many women will say, it's okay, I'm fine, I'll get through it, I'll tough it out. And I'm going to tell you, put on the list that depression is one of the symptoms and one of the reasons to go to your doctor, because it increases the risk of heart disease so significantly. It's associated with heart attacks and cardiac death in young and middle-aged women compared to men. And I'd like to mention that in women less than 55 years old, there is an increase in heart attacks and strokes, and there is an increased risk that we're seeing across the board of cardiovascular disease. Part of it, I believe, is because of this psychosocial piece, the depression, the stress, the anxiety that women have been living under and not addressing, leading to difficulties in taking care of themselves, often leading to high blood pressure, high cholesterol, diabetes, being overweight or obese, and leading then to heart disease. We have to figure out how to manage this stress. We have to figure out in all of us how to decrease this stress response, get rid of the norepinephrine and the cortisol, decrease the inflammation, and promote health and well-being. I always tell everyone, you've got to stay in the present. We, if anything, have learned anything during this time. If we don't stay in the present and we look towards the future, we can become so anxious. We can't even predict what the future is going to bring us. So that anxiety is so difficult to manage. And if we go back in the past, we can become depressed, not understanding how to manage what has passed us by. So staying present is one of the keys to really managing stress. That's about being mindful. It is a way to handle that immediate stress reduction. I can't go there and I can't go there. I'm going to stay right here. And I'm going to be mindful. And it's going to reduce that stress. Of course, we've heard of breathing and the importance of having a breathing practice. When that stress happens, I promise you, take an inhalation, 4 breaths in, 6 breaths out. It's going to stop the stress response right in its tracks. And having gratitude. Believe it or not, there's a continuous stress reduction with just having gratitude. In fact, there was one study, it was called the GRACE study, and it looked at people who had heart attacks that wrote letters to their doctors and nurses thanking them. And what happened was these people had healthier behaviors. They had a better quality of life. They had a lower rate of depression and anxiety after their cardiovascular event. It had such beneficial outcomes that they became more emotionally resistant, and it improved their well-being. There was an improvement in their compliance with diet and exercise, and we always have to go back to that. But there's something very interesting about gratitude and reminding yourself every single day, at least be thankful for 5 things. Before you think of all the bad things that have gone on, 5 things. Can't do 5, do 3. But try and find some gratitude every day. Meditation is also so powerful. It has effects on the brain. It regulates our emotions, decreases this physiologic response to stress, decreases anxiety, depression, improves our sleep, and improves our overall well-being, decreasing also blood pressure and inflammation. And for those who are trying to quit smoking, it actually helps. There's so many different kinds of meditation. You got to learn about them, figure out what works for you. There's been tons of research on transcendental meditation and its benefits in cardiovascular disease and decreasing blood pressure. So I often recommend that. But having social support matters. Being in relationships that are supportive of you, that give you that feeling of having an infrastructure and strength, they matter. And people with large support networks experience a lower mortality rate. We learned during this time that being together was not happening. So many of us learned to hug each other virtually through Zoom calls and FaceTime and just connecting in a different way. And I'm sure all of us can't wait to get back to giving people real hugs. Being in positive and fulfilling relationships also is important, and satisfying relationships may slow the progression of heart conditions. Being in a good marriage actually prevents cardiovascular disease. And laughing is also really important. When you're in a bad mood, we tend to say, I'm going to go to a sad movie and cry. Don't do it. Go see a happy movie and laugh, because laughter can dilate arteries and increase blood flow. It actually works on that lining of the artery on the endothelium by dilating the artery, decreasing blood pressure, and actually decreasing mental stress. I want to do a quick experiment. I'm going to show you two faces. I want you to let your eyes get drawn to the face that it wants to get drawn to. Are you ready? Let's go. Okay. How many of you saw happy faces? How many of you saw the sad faces? Here's what we know. As we get older, our biases grow. We tend to look at things negatively. We tend to get drawn to the negative faces. We, in fact, grow older and become more pessimistic. When you see babies and you smile and you coo at them, their eyes are always drawn to the happy face. But as we age, our eyes are often drawn to the sadness, to the pessimism, to all the things that could go wrong. But believe it or not, optimism may reduce the risk of cardiovascular events. When we think about it, how we wake up in the morning, how we start our day, is it glass half full? Is it glass half empty? If we start our days glass half full, we actually might be improving our heart health, protecting that endothelium, and it might actually decrease the incidence of heart disease. Having a purpose in life is also so important. Your reason for getting up every day, why are you here? We are all here for a reason. And having that purpose in life, believe it or not, decreases mortality. So your prescription for health and well-being is about living from the heart. It's about finding out who you are. It's thinking about yourself physically, exercising, eating right. It's about thinking of yourself socially. How are you going to communicate in relationships? How are you going to be in relationships that make you feel better? Intellectually, how are you going to challenge yourself? How are you going to see the world in a way that allows you to question things, to understand things, to maybe become optimistic because you have an understanding and a sense of empowerment and control because you have knowledge? Spirituality, having faith, has been shown to also be helpful. And emotionally, how are we going to dial down our stress, our anxiety, our depression? How are we going to sleep to sustain us? And behaviorally, how are we going to act? How are we going to choose to be? Are we going to be optimistic? Are we going to have purpose? I ask you today to understand heart disease is the #1 killer of all women. It's subtle, it's scary, it can catch up on us if we don't pay attention. If we live our lives without truly understanding that there is a network of arteries inside of us that are layered with this one cell layer called the endothelium that we actually have control over by how we choose to live every day. If we have ownership over ourselves, empower ourselves with knowledge, information, and we get to then understand who we are and what we need to do to keep us healthy, then I will tell you, 80% of the time, you will prevent heart disease within yourself. The next thing you need to do, you got to get checked. You've got to know all these numbers I've talked about, the blood pressure, the cholesterol, the sugars. You have to know your family history, and you have to take a really good look at yourself in the mirror and say, how am I eating? How am I exercising? Am I sleeping enough? Am I actually putting myself on the long list of to-dos where I always put myself last? Living from the heart. Live truthfully and authentically and honestly, drawing strength and consolation from work, family, love, and health. Cultivate and nurture those things. not from your head, where logic always rules, but from your heart, where you can feel what is right and real for you. Live that way, and chances are things are going to be just fine. And that's from my book, The Heart Book. Thank you so much.
Dr. Steinbaum, I cannot tell you how thankful I am that from the onset of Women's Health Conversations, you have consistently brought us this message and educate us. I mean, these data that you presented today are critical and really boiled it down for us. And I'm just really thankful. And the way that you and your book talk about living from the heart, I feel like I honestly feel like I need to print some t-shirts that say love your endothelium. I mean, that'll get people's attention, but I really do love these data. And I love the slide where you're identifying how every part of our lives affects our heart health, you know, the stress, the social, the sitting, I mean, we think too oftentimes that we are a bunch of individual bricks, right? Oh, we've got a knee, we've got a head, we've got a this. And many times that's the way we've been treated. But you have so clearly shown us today is that we're a whole person. And that
I think we forget.
Everything is connected. And I love what you've said about this. So help us understand, you know, let's say I make an appointment with you and we show up and I say, you know, my family dies of heart disease, which is true.
Yeah.
Tell us by walking me through what should happen, what people should expect versus, oh, you have high blood pressure. Let's give you this, whatever pill is for high blood pressure. And you walk out the door.
Right.
It's through so that we can use our voices.
Okay, so here's the deal. We have to understand that heart disease and who we are is really made up of a total puzzle. There's anatomy, there's physiology, there's functional data, there's genetics, there's metabolism, there's inflammation. And I look for all of these to understand what your risk is. We can do screening tests that looks for plaque in the arteries. We can actually figure out what's going on. So, you know, let me say it this way. When you get a mammogram, you can actually see the picture of your breast. You know what's happening, right? When we want to look at the heart, we can't do that. We can't just go inside and look at it. So we have screening tests where we can actually say there's a coronary artery calcium score. It looks for plaque in the arteries. It looks for calcium in the arteries. That's step one. Then we could look at functional data by looking at the health of the endothelium, by seeing how well it can dilate under stress. We can actually look at functional data. I put all my patients on a cardiopulmonary exercise test. We can see the connection between the heart and the lungs. And what is so fascinating about it is we can see the health of the endothelium, because delivering oxygen requires arteries to dilate. And when those arteries don't dilate, we can't deliver oxygen, and we then exercise on anaerobic activity and not aerobic. So we can then look at the inflammatory markers. Interleukin 16 is associated with stress. We can look at other markers of the endothelium to really see what the issues are. We can then look at the cholesterol, but just not the numbers, the genetic markers, lipoprotein a, apolipoprotein E, as I mentioned, to show you how you metabolize certain foods. We then look at particle sizes. We look at all different aspects of the cholesterol, not just the numbers, but is your body overproducing cholesterol? Is it overabsorbing cholesterol? We then look at your metabolism. How do you metabolize sugars? Is your hemoglobin A1C up? What's happening to you living the way that you're living? We then understand if you're depressed or anxious. We get an understanding of your lifestyle. Are you taking care of kids? Are you homeschooling? Are you going to work? Are you doing the laundry? Do you got help? Do you have support? What's happening in your life? Because without understanding this whole big thing, we're not going to get it.
That type of approach sounds so different and so welcoming versus take your blood pressure 3 times. If it's up, then go on this medication, right? It's so much more than that. And, women's health conversations crowd is largely 40, 50, 60 plus. And we talk a lot about, and you talked about it today, how heart disease risk goes up during the perimenopause. So, all these things that happen to us as estrogen walks out the door. When should we start? Sometimes the millennials are turning 40 right now and they're like, oh my God, I'm an adult. I better start something. When should people seek out this kind of information from someone like you? How do we get in tune with our how do we know ourselves well enough? When does that happen?
So everyone should have their numbers checked at age 20.
Mm.
But I'll tell you that one of the things that we've seen statistically, women are having children later.
Yes.
We're seeing women have more problems with pregnancy, like preeclampsia and gestational diabetes, even high sugars and high blood pressures.
Yeah.
And for all of those women, I always feel like saying to them, have your baby and come in to see me next.
Oh,
Because the issue with having all of that, having gestational diabetes or preeclampsia, all of it, is due to endothelial disease. Pregnancy is the first stress test. And if you have any stuff like that, it means the endothelium is not healthy. So you need to come in and you need to figure out why.
oh my gosh.
That for me is the message that I want to tell younger women now,
Mhm.
which is I get you're 35. I get you're 30. I get you just had a baby. You're going to be fine. Everything is going to be okay. But in 10 years from now, your chance of being diabetic or having hypertension for real is significant. So let's deal with it in management before we get there. And for all other women, and I can speak for many of us who are like, we thought 40 was never going to happen because it was so far in the future.
It's not that old, people.
And then all of a sudden you're like, wait, how old am I? Because if the millennials are turning 40, oh yes, it's for real.
It is.
And all of a sudden you're that person who is going through the things that never got spoken about, the perimenopause. Like nobody talked about perimenopause when
Right.
we were growing up. Nobody talked about this menopause thing and what it feels like. And so I want all women to know it's a real thing, but you don't have to go through it in a hard way. The most significant way of reducing hot flashes is through exercise.
Mhm.
So if you start early, if you actually really go through this process in your 30s, in your 40s, so by the time you get to your 50s, and the average age of menopause is 52, by the time you get there, it won't be a problem for you. And as we know, as we go through menopause, all the risk factors go up. But for women less than 55 who are suffering because we have not been paying attention to ourselves and have not been thinking of that group as being at risk, you're the group I'm really talking to, which is we can change this. We can change these statistics. We can actually change our own personal existences on this planet by taking care of ourselves.
Well, and I can give testimony to this exactly progress that you're talking about, because people who know me, and even if you don't, I mean, I'm an orthopedic surgeon. My entire career has been focused, and all the books I've written are about how to optimize our health. But even I, having had my first biological child at 40, paying attention to a great diet and burning 1,900 calories a day in the OR. I mean, the work I do is very physical. I did not do the things that you're talking about to prevent the long-term sequelae of my genetics, of how to optimize my diet, and really pay attention to the role of exercise until I was slammed in the face with estrogen walking out the door. And so I think if we can reach women earlier, and in reaching women earlier, frankly, you mentioned today about your son. My children are the same. My biologic children, my blended family children, they cannot help but know the lifestyle factors that are going to lead to a heart healthy life, because it's been indoctrinated, to them. So that just shows the power of women. When we change the health of one woman, we will change the health of everyone they touch. And I know that's a passion of yours too.
Yeah. I think that's what you're doing. That's why I'm here.
Right.
We've learned this a long time ago, you and I. I think that we share this passion for writing and speaking, not as a hobby, but because we really, really have a passion for educating women, because we understand the more that we empower women, the more we educate women, the better this whole world is going to be.
Absolutely. Absolutely. And I know we share this. As you said that, I felt it in my heart, if you will. Listen, we speak like that, but I think you're right. It's all from the heart. I have this desperate passion to change the lives of women, because we are so important to everybody else in the world. I mean, I could find an easier hobby, right? So could you, but this is not a hobby. This is a desperate passion to connect women with their whole health, and do it from the heart, right?
It's an amazing feeling to have patients in the office. I'm so lucky because I get to see lives change, and I really do. And it's really extraordinary because I'm doing this every day. And this week I have people coming in and they've been on the program 4 months. Wow. And all of a sudden cholesterols are coming down, blood pressure is coming down. The most important thing I hear is, I didn't know how badly I felt. I didn't know. I didn't realize I was tired. I didn't realize that I wasn't my best self. And I'm starting to feel so good. And it's only 4 months in, and I'm like, wait till 4 more months. It's going to be awesome.
Life is going to be so amazing.
It's going to be so good. Yes. And watching that transformation is huge. But I think we both speak the same language. We have this heart connection in this, is that the more that everyone listening here today embraces it and tells 4 friends, I say there are 4 chambers of the heart, so tell 4 friends. 4. The more that we can educate and really have women understand how much this matters. And it's hard to explain until you actually go through the process. And I want to say, we all have to get our healthcare from healthcare providers. Mm-hmm. And we understand there's a limitation to humanity and human beings. Mm-hmm. We understand there's an unconscious bias because there's disparities in care between men and women. Mm-hmm. So there's a problem there, right? No one's trying to hurt you deliberately, but there's something going on. And so if we don't really empower ourselves and advocate for ourselves, we're going to have a problem getting the care and the help that we need. Right. And so part of what I'm saying, and part of why I'm here and why I'm talking to you, is to say, you've got to walk in the door and say, I understand I'm supposed to have crushing chest pain as the sign and symptom of a heart attack, but hey, maybe that's not what I have. So let's look for it anyway.
That's right. Well, Dr. Steinbaum, thank you for once again working with Women's Health Conversations and me. And women are going to start from these conferences seeking you out, because everybody wants to feel better and they want to feel healthy. And I love the whole approach that you take to not just treating an isolated blood pressure or an isolated headache. It's the total woman approach and living from the heart. So thank you so much for being with us today.
I thank you. And just for everyone to find me, it's DrSuzanneSteinbaum.com. The lucky thing about quarantine has been telemedicine, and I really am willing to really have these conversations one-on-one. I think we all need to seek out the best care we can get. Wherever we live, you got to take the information to your own healthcare provider. And I thank you, Vonda, as always, for being part of your journey and for helping, letting me be a part of educating the women in your life.
Thank you so much. I'll talk to you soon.
Take care.
Bye-bye.
Bye.
I hope that you have taken as many notes as I have about the data that Dr. Steinbaum has shared with us, and that you will look her up. It's very easy. I go on her site all the time because you deserve it. You deserve to know the truth about being treated as a whole person. You deserve to walk into a physician's office and say, I know it sounds like nothing, but it's something, right? Find your voice. And that's what today is all about. And again, I'm going to say it again. I've always loved Dr. Steinbaum's approach to living from the heart. So I just think that was amazing. This morning in this session of addressing the whole woman, we have been talking a lot about what seem like medical topics, right? But many of us in our lives will undergo procedures or surgeries. I mean, I'm a surgeon. People not only get to talk about being a whole person with me, but we talk a lot about surgery. And surgery is scary. And being put under and not knowing what's going on is scary. So I have asked this morning a new colleague of mine, Dr. Carrie Atcheson, to come and talk to us about her perspective on access to the best care. She is a practicing anesthesiologist. If you're going to go have a procedure, besides your surgeon, she is the person that you also trust the most. You put your life in her hands. And so she comes to you with an education about your best preparation and access to care. She is also the host of a great chat room on, I have to look it up, Clubhouse. That was a senior moment right there. I haven't had to say that word in a minute. I go on her Clubhouse every Wednesday night that I can. It's Women MD Wednesdays, and we just get together and talk about all kinds of topics. So I am so proud and happy that Dr. Carrie Atcheson has joined us today. Are you here?
I'm here.
You're outside in the gorgeous weather. Talk about amazing self-care.
Yeah. I couldn't not bring everyone outside today because it was just too beautiful.
I'm so glad you've been here, and you've been listening a little while to the conversation that we just had with Dr. Steinbaum. Does it resonate with you, the approach to the whole woman, not just some body part, not just the endotracheal tube? We are head to toe, an entire organism. Does that make sense? Listening because you're a wife, a mother, a clinician, you wear so many hats too.
Yeah. This is what I do every day, Dr. Vonda, is talk to people about how we're going to take care of their whole body. So that's, when I talk to patients, I say, you're going to have surgery and we're going to take care of the rest of you.
Oh, I love that. Well, I know you have some slides and information to show with us, so I'm going to pop out.
I do have some slides, and I think you should be able to see them here in just a second. And I'm going to be very cognizant of the fact that I'm the last session, and that there may be a little information overload because of the amazing information that Dr. Caudle and Susan Koeppen and Dr. Steinbaum have given everyone. So I just want to let everybody know how to get in touch with me in case you want to access this information again. So I am Doc Atcheson on all platforms. And then where you can really find most of this information is on my website, which is readyforsurgery.com. And you also should have received an email that has a link to a tool that we'll talk about a little bit later. So I just can't tell you, though, how excited I am to be around, to be here. Thank you for the invitation, Dr. Vonda, and to be around women who care about what I care about, which is shifting the conversation around health so that women have the representation, the research, the products, the providers, and just the basic TLC that we all deserve. And I'm going to talk today specifically about improving your access to the best medical care by taking control of your health information. And because I am an anesthesiologist, lots of my data and experience comes from people who are having surgery. But I will say it does translate into emergency preparedness, into everyday health maintenance, and into the management of chronic health issues. So I have kind of a theoretical question for everyone, which is, I just want to ask you very quickly to think about, would you allow a store to take care of your credit card and your credit card statements? It's just a thought. And as you're thinking about that, I'll kind of talk about a little bit about where we're going to go with this, which is we're going to talk a little bit about taking control of your health information, because truly it doesn't belong to you unless you take control of it. And no one else is going to take better care of your health data than you. And it's truly becoming easier than ever. So the tools to do it are out there, and we'll talk about them. And I hope that sort of at the end of this 15 minutes, you'll think it's 100% worth the effort. So talking about that quick question, would you let that store keep track of your credit card and your statements? And the associates could access them whenever they needed to make any necessary charge or adjustment. I mean, they would promise that you could see it whenever you wanted and take it to another store if you needed something. But my guess is that none of us are really mentally raising our hands to volunteer for that financial management plan. But this is really what we do with our health information. The clinics and hospitals keep not only the power to recommend and order things, but they also retain the records of all the activities. So in about half the states in the US, there are specific laws stating that hospitals or clinics actually legally own your health records. And in the remainder of states, they're seen to be jointly owned. There's one rare location, New Hampshire, where patients legally own their own health information. So if we have any folks from New Hampshire in the audience, y'all can stand proud that your health information is living free out of the control of outside entities. But functionally, this means that in most places, it's not easy for patients to get or change their health information because technically they don't own it. But this landscape is shifting. So recently there was a big win for us, for patients in the US, to control their health information. This past April, on April 5th, CMS began enforcing the 21st Century Cures Act, which was actually a 2016 rule. And it required that all health organizations provide patient records in a timely manner on a secure online portal. So by 2020, all patients should have access to an online portal maintained by the hospital or clinic that shows them their notes and test results. So because of these portals and because of the landscape we're kind of living in as patients, the next 5 to 10 years are going to be a period of rapid development in the health information industry. As these, not only as these portals develop, but also, and this is really important, as third-party products. So that's kind of apps or services that can manage individuals' health information develops. And we'll kind of talk a little bit in a minute about what individual patients and advocacy groups can do to affect change during this interesting time. But you know, I have to own this, and I was really glad that that Dr. Steinbaum came on and you know, got to talk about her passions. I'm a little bit of a dork about health information, so I want to talk to you a little bit about the history of electronic health records and our healthcare information. So, you know, a lot of people wonder, how do we get to this point where every clinic and hospital system has a different computerized medical record and none of them are talking to each other? Well, about 20 years ago, everyone thought that interoperability, which is the condition where different clinics and hospitals, medical record systems could easily share information. We thought that interoperability was inevitable. We thought it was a sure bet. We as a country said, we won't mandate that everyone use the same system. Instead, we'll let the open market do its thing. It'll inspire competition. And then we'll take the cream of the innovation crop. We'll choose a few of the best systems. We'll make them talk to each other. And voila, a national health record. Unfortunately, that plan was, pun intended, an epic failure. The exact opposite happened. Free market competition did indeed do its thing by producing a huge variety of medical record systems. But the problem was that each system is built on a different proprietary digital underpinning called a platform. And each system quickly became entrenched because of the high startup and implementation costs. And as anyone who's worked in healthcare knows, I know Dr. Vonda and I know, the changing of a medical record system is so costly in terms not only of money, but of healthcare personnel time and sweat equity, that it's almost never done. So we ended up with not a few, not dozens, but hundreds of healthcare information silos that have no ability to talk to each other. The technology to get all these systems to talk to each other just didn't emerge, and the political will to make change happen or fund it just wasn't there. So here we are, and I'll kind of call you back if you had strayed or tuned out during my giant dork out session with you about the health information. But we're going to talk about what we can do. So as a doctor, the answer for me professionally is research and innovation. The choice of what to buy and how to implement is rarely made by clinicians like me or like Dr. Vonda or like your family doctor. But as a patient, as patients, all of us, or better yet, as a group of patients, like at Women's Health Conversations or with a group of fellow employees at a large company or with a union, patients as and advocates, the first thing we can do right now is team up. And then, as an individual patient or as a caregiver for your loved one, you can take control of that health information by accessing your portal. This is what my patient portal looks like. It's where I can communicate with my primary doctor at the University of Alabama at Birmingham. I can see my test results, my clinic notes, my messages from my physician to me. So many of you, I'm sure, are using something similar. And I encourage you to check your portal, read everything you can, and send a note directly to your doctor if there's any information that's incorrect. Correcting electronic medical records, unfortunately, is something that's really important because incorrect information can perpetuate for years. Every electronic medical record is also an insurance billing program. So, I hear stories in patient advocacy circles about incorrect information that can result in higher insurance premiums and even incorrect charges to insurance. So this is a very important way to kind of take control. But the portal doesn't really contain everything. It only contains the information that's supplied to you or to your doctor or information that was generated at that place within that system. So we all have to the next thing that we can do is keep a file. So this can be an electronic file. It can be a real paper file. Start with a blank sheet of paper or a fresh spreadsheet. And it's something that can be started today or the next time we go to the doctor. I would certainly recommend starting a health information file if you or your loved one has a new diagnosis, has been in the hospital, or is planning to have surgery. During the time of surgery or hospital admission, not only is a lot of information required, and you sort of want to make sure that it's right there in front of you and that's all correct, but a lot of information is created. And so you want to have a plan for how to keep track of it. So I'll walk quickly through an example. Here's how creating a health information file would look if you were, say, having a total knee replacement. At the visit where you decided to have surgery, you can figure out how to access all your health records. You can make sure that you have a copy of any images that you use to help plan your surgery, like x-rays or an MRI, and the clinic note where your surgeon wrote about the decision to have surgery. And just a note about images, if you're creating your health record file, it's a good idea not just to have a printout of the images, but to have them stored on a CD. Radiologists and surgeons and proceduralists only read digitized images. So if you decided to go to a different hospital or have a second opinion and you wanted to maybe have your surgery there, you would have to carry the CD with your images with you, or they would have to get new images, which understandably could end up being a problem with your insurance company. So just a note on images. And then during scheduling and pre-op visits and pre-surgery education classes and your own online research, because I know we're all Googling it, keep the stuff that serves you well. If the clinic gave you a printout of some instructions and the last few pages were what to do about if you're diabetic and you're not diabetic, it's okay to throw it away. So throwing away things that don't apply to you, personalizing your health file, or taking notes and only keeping your notes are good ways to avoid that information overload. I would also suggest, and I'm just going to quickly apologize to everyone that my choice of being outside also may involve some background noise with the dogs or the rooster. So just apologies in advance. But as we're talking about creating this file, I would suggest making a separate folder for financial information and insurance information. How to prepare financially for surgery or how to recover from a hospital admission financially is sort of beyond the scope of this talk, something I'm truly passionate about, but keeping records is essential in this process. And so that's a good place to start, is just by keeping those records and looking at them. During the time of surgery, try to decide who's going to be in charge of your file, whether it's a partner, a friend, a child, and then include the copies of the legal document that states your wishes if there's a life-threatening situation, and also the legal document of who your healthcare power of attorney is. If you want to be extra savvy, you can use a tool like the one-page health history, which I think you have a link to in the email that was sent out earlier today, and you can also find on the Ready for Surgery website. It's a tool that creates a summary of the things in your health history that are most important for your safety and well-being. And I could not have asked for a better introduction to this topic than Dr. Caudle and Dr. Vonda Wright chatting about how to summarize this information. So this is one tool that you can use for how to succinctly and in a really focused way that's going to be high yield for the folks who take care of you, how to summarize that information. So as you're kind of getting all this together, you're going to be able to be ready when somebody asks you for the 33rd time to confirm your allergies, or when somebody says, well, what really was your diagnosis when you were in the hospital before? You're going to be ready, and that's hugely empowering. And finally, one thing to do is to keep an eye on new products. So we all love to have the latest thing, and over the last 5 to 10 years, there's been a huge development in the industry of wearable technology, and the next 10 years, it's really just going to explode. There are going to be multiple third-party apps that manage an individual or family's health information, including everything from the medical information we're talking about that goes into your health file. It'll probably be stored as sort of a PDF or as a scan. And then also you'll get to store data from commercial wearable devices like your Apple Watch or your Fitbit or your Whoop. And then probably also there's going to be a way to store what we would call data from biometric devices. These are medical devices that have a therapeutic use. One example is lots of companies, the one that makes the most widely used one now is Philips, has a wearable biosensor that folks will wear in the hospital that detects vital signs and steps and position. And also they're used in physical therapy or to monitor your blood pressure. So when these products come on the marketplace, I'm going to give you kind of a quick 3-item way to evaluate them. So first you want to look at safety of data. So how do they keep your data safe? Where's the data stored? Who can access it? And especially to whom is it sold? And then I'll also say that another thing you want to look at is price. For a wearable device, for a biometric device, for a healthcare information platform, under no circumstances should you use a free product. In the world of software as a service, free is never free. So there's a possibility, there's always an upsell later, or potentially they're mining that data for research or for profit. So look at your terms and conditions early and pay something reasonable, but pay something. And then finally, usability. How does it help you organize your health information? And can the system produce tools for communicating with your doctors and nurses? So that's my quick way to evaluate those wearable devices. I hope that this has been helpful. I know that it's been a lot, and I know it's the end of the day. But for so long, our health information has been in the hands of providers and institutions, and it can really seem daunting or annoying to have to keep track of it. But going back to the credit card analogy, truly the safest way to use your credit card online or in person is to keep the card and statements with you and to re-enter your credit card number whenever you're making a new purchase. So I just want to thank you for your time and attention. I hope that you can see that we're building something here. And I know that paradigm shift can be kind of trying and time consuming because making new habits is it's just costly for our human brains. But I assure you it's worth it. and taking control of your health information will increase your access to good care by giving you time to have those deeper, important conversations about the symptoms that you are having and truly ask the questions that you want to ask, because you have the information at your fingertips and you have that peace of mind. So thank you so much.
I am so excited about what you just shared with everyone. And even, I mean, I love the geek out part because I have always wondered, WTF, what's up with 54 medical records? I mean, I work at a hospital where we do have a centralized medical record system, but every doctor's office is allowed to have their own. There are at least 54. And so when a patient comes in with the expectation that, haven't you talked to my doctor? Or we're calling for faxed information. I mean, WTF, it's an epic failure. I mean, you could not understate that problem patients have.
Yeah. I mean, it's huge, and it's so frustrating for everyone involved.
Yes.
And so, we are going to see those changes coming over the next 10 to 15 years, but there's going to be, I don't want to say there are a lot of opportunities for, for people to be taken advantage of, but there are. It's just really important to kind of safeguard that information, and really the only way to safeguard it, just like with your financial information, is to keep it yourself.
Own it yourself. Gone are the days when right when I began training as a nurse, actually it was in the 90s. I can't even remember the date. It was so far away. That is when the paternalistic atmosphere of the patient as submissive or the patient as following along, like they were not the current in the stream. They were just some boat, right? That is gone. What you have said today is so incredibly powerful, because if we don't captain our own ship, our ship may go askew. So I always tell my patients, yes, I am the quarterback of this part of your care, but you must be your own advocate, because it is not uncommon for people to say, I told them to send you my information, or I don't know who did surgery on me last year. And I always encourage people, you have to have your own voice. And that's what your company is all about. That's what this talk was all about. And I'm going to tell you, listeners, that I've said this 3 times today. We are a multi-generational family, and I have written out my parents' health information. And every time we go somewhere else, we just print off a copy, which we keep really up to date. And we say, here it is. This is the latest, because if we don't know it, nobody's going to know it.
Yeah. And two, you want to have it there at your fingertips, because the only way for you to truly be safe when you're coming into the hospital is by confirming all of that information. Because it's the electronic health systems are fallible. So people get frustrated because there's not that information exchange, but it's so important. The safety of the information is so important that really the only way to stay safe is to own it.
That's right. And so it really, if you've heard nothing else from Dr. Carrie and I, is that you have to take responsibility, just like you do for your financial information, for your health information. Keep it all in one place. You can use Dr. Atcheson's templates and data gathering methods, because we have to use our own voice. We are a whole person. We're just not a sum of the little parts, because everything works together. And this is so critical. So I am really excited that you introduced to people this part of caring for yourself as a whole person. So thank you so much today for being with us from your beautiful outdoor chicken. Did you say?
Our neighbors have roosters. And so they crow at any time of day. So it's it's also a little wild out here.
That's so great. Thank you so much again for your time and expertise and giving us a voice about our health data.
Thank you for the opportunity. I appreciate it a great deal. It's been so wonderful.
Oh, thank you. I'll talk to you soon.
Talk soon.
So I am overwhelmed with the amount of data that we've had this morning. I mean, we've only been going 2 hours, and I think that what you've listened to today is priceless. As we started the morning talking about framing, we're a whole person. We're just not a headache, a knee, an arm, a high blood pressure. Everything works together. And I think you saw that in the example that my friend and neighbor and Emmy Award-winning journalist Susan Koeppen shared with us with her own health story. The way that Dr. Suzanne Steinbaum put it all together for us using the example of heart health, that everything contributes to our total health and how we feel on a day-to-day basis. And finally, with Dr. Carrie Atcheson going deep with us to tell us why we must use our own voice and be our own advocate. You know, this is what Women's Health Conversations has always been about: empowering, educating, and sometimes entertaining women to pursue the best of life, to prioritize your body, brains, and bliss. And if this morning was meaningful for you, if you agree with me that you are never going to get this in depth just by cruising around the internet, I want you to go check out our new membership community. It is a private membership community for women 40, 50, 60, and beyond. You know, if millennials want to join, we are here for you, our daughters. We are here to teach you. Every woman in this membership is in passionate pursuit of the best of life. And so the website is brand new, ageless.life, spelled phonetically, because we are authentic, we are ageless, we are indefinable, and every week we are going to put in highly curated information about some of the things that you've heard today and the things that are going on in the rest of this Best of Life Summit. Now, the reason it's important that you do this now is because those of you who go to the website, ageless.life, during the summit will be founding members. There are profound benefits of being a founding member, including a greatly reduced price. If you sign up for a full year of being with us in this amazing community, you get 2 months free. I think what you've heard today is worth it. And we're not even halfway through with what we're going to do. So anyway, check it out. Ageless Life. If you are ageless, authentic, indefinable, or wannabe, this is the place for you. So anyway, we had an amazing morning. We're going to take a break now. We are going to come back together for our next session about the best of health, 6 pillars. We have another group of amazing speakers. So I'll see you back here at 12:30. Bye now.